Right, hello. This is
Hi,
episode 65. Hello, Sylvain. Mancuso has joined me from the northeastern seaboard of Canada. Very again, it's been over 5 years since we last had a chat. So, ladies and gentlemen, boys and girls, whoever else might be listening, welcome to the podcast. And Sylvain is a wonderful gentleman who is a professional clinical osteopath. Has worked with the Wildcats and other sporting teams to not only put in place concussion prevention protocols, but he also has a lot of information to give us on diet and other means of recovery. So, Sylvain, how are you doing, sir?
I'm always good. Fake it until you make it. It's what we say.
Good stuff. Très bien. Um, so, if you want to look back, by the way, episode 40 is an audio podcast, which is the first time I had Sylvan on. And thank you for being so generous with your time to come back on again today. Would you like to just do a quick recap for anybody listening and watching at home, please, to tell them a little bit about yourself, your work, and your background?
Yeah, okay. I'm an osteopath by trade. I was physiotherapist in France, and I moved in Canada in 2011. And my biggest I have a kid. He had 5 years old at this time, and he wants to play hockey. And it was in the middle of this big concussion stuff with Sidney Crosby. Then he had a big injury, a big hockey player, and he missed almost 100 games. And from that, I begin to be interested about okay, concussion, but what's a concussion and how we can prevent it. Then after a few years working with the Wildcats, developing a prevention program. When the COVID hits, I said, okay, I need to do something because they shut down my clinics. And because, with the COVID stuff. And
Hmm.
I decided to launch, at this time, was Concussion Heroes. Then my goal was to help people prevent concussion using diet, exercise, working on peripheral vision, posture, and all that. What I was doing with the Wildcat since 9 years at this time. Yeah, 9 years. And after almost a year, nobody was interested in prevention because people doesn't care about prevent. They just wake up when they have the injury. And I still doing that with the Wildcats. I still have some player coming to me, but often I have player coming to me before the season to just do a checkup to see, okay, how is my posture and my mobility and all that. I have some NHL player that I work with, and just help people to prevent. But the evolution of the clinic now, we are more we are osteopath, chiropractor, massage therapist, nutritionist, naturopath, and metabolic testing specialist, or metabolic specialist. And our main work is to help on biohacking side, try to help people to stay healthy longer. Um,
Yeah. Mhm.
in my family, I have two examples. My father, who has past 5 years really hard, on him, is not living the life of someone who was hoping he has an accident, and
Mm.
I have on the other side my grandfather who ran in the mountain of Italy until 85 years old, because he was really in shape. Then my decision last year was, okay, which type of old guy do I want to be? And yeah, right, and the decision is pretty fast to
Yeah.
take, between, and more you see the study, more you see that the last 10 years of your life are way worse than our parents because chronic illness, cancer, and all, Alzheimer and Parkinson and autoimmune disease and all these things are just eating you. Then at the end, yes, you live until 85, but the past 10 years is your last 10 years is really bad. Then my decision was, okay, I really want to be in shape and enjoying life. Then what do I need to do? But it's like on a map. You know where you want to go, but if you
Yeah.
don't know where you are, you don't really know the path. Then
Well,
I begin to say, okay, the medical system is failing us. They don't care about that. They just look at how you have headache. Oh, take something for the headache. Yeah, but why do you have headache? Do I have headache? Or why I have back pain, or why I'm feeling like shit. I have no energy. Oh, take vitamin C. Yeah, but why I'm feeling bad? You know what I mean?
yeah.
And in Canada, I think it's the same in many European countries. They say we are lacking a physician and nurse. And my opinion is we have too much sick people because the health system and the food industry and the pollution outside just
Mm.
make more sick people than 80% of the people who are in ER not must not be there. That's simple.
Mm.
And if you look at the picture, the government is still helping this big food industry poisoning people. And on the other side, you have the big pharmaceutical company who are just waiting for you to be sick and make money on your back. You know what I mean?
Oh, yes, yes,
Then,
yes.
then with my experience and all that, I said, okay, where is the best place to take people before they falling on the sick side? And it's why I moved my clinic from pain to pain and longevity. Okay, you come from back pain, but how's your diet? How's your energy? How's your sleep? Because everything is together, your posture and your mobility, but it's really a osteopathic approach, a global and a holistic approach about health. Then now we implement metabolic testing, DNA test, blood test. And from that, when we have all the information, say, okay, now we understand how your body is working. That's the small tweak we can do because I don't know if UK is the same, but in January here, you can't find a space to park your car in front of a gym because
Yeah.
everyone wants to change. But in February,
No,
it's
true.
crazy empty. There
It's
is
true.
no one. You can park front of the gym. Nobody is there because people doesn't like the brain like comfort. It doesn't like to
Mm.
change too much things. And when the 1st of January arrives, you say, oh, I want to change my diet. I want to go to the gym. I want to do this and this. After a month, the brain says, hey, stop.
It
It was
dissipates.
good to stay on the couch,
Yeah.
eating your chips. It was like that for the past 10 years. Don't change everything. Then our approach is have the data, and from the data, we can give you exactly the right tweak. Your zone
Mm.
two. We have so many people training way too hard with no results, or the type of food they eat, or we are big on anti-inflammation. We are big on weight loss, because obesity is increasing the level of cortisol and the acidity and inflammation in your body. Then we have a multi-focus approach to try to help people to stay healthy longer. And but I learned from my concussion experience. I didn't have any. I think I had. Maybe I was playing rugby, and I'm sure I had. But at this
Yeah.
time,
Mhm.
they were just keep you a slap in the face. Say, okay, go back to play.
Punch.
And yeah, right. Yeah, right. And,
More like.
and but yet now the clinic is more about biohacking and long-term vision because,
Mm.
and I think many clinicians must evolve in this direction to really have a holistic
Mm.
approach about health. And if we go back on the concussion side, um, removing or milk, not because not all dairy products are equal. You know, when you take yogurt, it's bringing you
Yeah,
specific bacteria in your gut, then helping with inflammation.
yeah,
But sugar and processed food must be removed.
yeah.
But nobody is talking about. You know, you go to the hospital, they look at, okay, you don't have any bleeding, have a good day, or you don't have any fracture and have a good day. But
But
they don't look and don't give any advice about food, about sleep, about the first things you need to recover after a concussion is your sleep. If you don't sleep correctly, your brain can't have this energy, you know. Have creatine after a concussion is really important. Nobody say that to anyone.
no, no, they don't.
That's
They don't
just
mention it.
what?
They don't mention it, do they?
No,
Because
no, no.
it's not in their interests. You know, the hospitals, the doctors, nurses, they don't know about gluten, sugar, dairy, the harms of that on the body. They're not going to tell you what supplements to take because they're not. It's not their franchise. Their
No,
franchise is simply the drugs that they're going to sell you.
and I think it's more because they are in an emergency. You know,
Yeah,
you go to the
they
hospital
are.
when you are not really feeling really sick. Then they don't have. I don't think
No.
it's they have the knowledge. They just don't have the time because there is too much people going to the hospital
No.
for nothing. Then
No.
we can take care before. Then, yeah, that's
Mm.
the evolution I had since 2020, from concussion to prevention of global health. That was my evolution.
Yeah, and it's important that you brought this points when we chatted just before the podcast started as well about anti-inflammatory means natural anti-inflammatory. Now, this is something that's been important to me for many years, and I obviously take 2 capsules of Novasol curcumin with D3 every morning. I have other stuff. I have an anti-inflammatory diet, and I know that that helps me with the effects of my aphasia, PCS, and fibromyalgia, and so on. So, if you could talk a little bit more about the dietary side of things, I think people at home will really appreciate that, Sylvain.
I think in Canada, in North America, 90% of the diet is pro-inflammatory. Then processed food, dairy products, but as I said, not all dairy products are on the
Right.
same level. Sugar is a big issue too. Then
Mm,
be able, chronic inflammation, because inflammation is good. I'm not going to say it's bad because when you eat your elbow in the wall, it's going to be red because it's part of a normal process of healing, you know.
yeah,
But the biggest issue the world population have on the West area, I don't think China or this type of country has the same issue because they have a
no,
better
no,
diet and access to better
no,
food. It's the subclinical inflammation.
yeah,
Then the subclinical inflammation is a low level inflammation who is just going to burn yourself slowly. When I was in osteopathy school, there was my teacher was saying a good fever is good. Don't take any things to reduce the fever before it's really too high. But if your body needs a fever to heal, let the body have the fever. It's
yeah,
like when you have diarrhea or you are vomiting because you eat something, don't take any medication, just drink water and
mm,
remove the bacteria because your body is made, it has automatic system to try to preserve the entire, your health. And inflammation is the same. But the issue is chronic inflammation.
yes,
And is a subclinical. There is a index called a Siri index, and it's with your blood test. You can neutrophil, macrophil, and lymphocyte. I think it's just a calculation. You can see that on Google, and you can see a bunch of people have chronic inflammation. And your diet, what you eat, is going to be a big game changer for 2 reasons. One, for example, sugar. Yes, it's not really good for your diet and your inflammation, but at the same time, uh, bacteria in your gut or pro-inflammatory bacteria in your gut like sugar. And the funny things is, I mean, the funny thing is, you know that there is gut health, a gut brain connection, and your
Yeah.
bacteria in your gut can control your brain and give you the feeling you want sugar. Then,
Absolutely.
then when you begin to cut sugar and eat healthy, you are going to kill this bacteria. And from these bacteria removed, you are going to crave less sugar. Then it's all connected. The other study I saw was a study about how the stress is changing your bacteria in your gut, and
Yeah.
show that high level of stress is going to increase the production of pro-inflammatory bacteria.
Yeah.
Then, it's all connected. Then sugar is one of the big things. I think all anti-inflammatory like curcuma or um, omega-3 or this type of things needs to be taken on a regular basis, because
Yeah.
our challenge today is the quality of the food we have and the quality of the nutrient we have. Then have some supplementation, but again, I don't know. I know in France you don't have the right to do genetic test. It is the same in UK.
Um, no, it's same, yeah. And
Yeah,
the food, well, yeah, and then the food industry's got about 100 different names, hidden names for sugar as
yeah,
well.
yeah. But because at the clinic, when we do DNA tests, we can see how you process some vitamins and some omega-3,
Yeah.
B12, B6,
Yeah.
all
All
that
right. Yeah.
together.
No.
But I think the supplementation is really important. The quality of the food, I don't know if you know this Dr. Hyman,
Oh yeah, Matt
HY,
Hyman.
yeah,
Yeah.
okay,
Yeah.
yeah, Mark Hyman.
Traditional medicinal doctor. Yeah. Yeah. I love Matt Hyman.
And he wrote a book called The Pagan Diet a few years ago.
That's right. Yeah.
And he was not saying you need to cut meat or you need to cut this or this or this. You need to be aware where your food is coming from.
Yeah. Of course.
And you can eat meat, but the quality of the meat needs to be grass fed, because
Ideally. Yeah.
the hormone of high farming meat is not really good. At the same time, for a long time, we say, oh, you need to eat salmon because it's full of omega-3. But if you eat salmon who's come from farming, it's
Yeah.
full of omega-6. That's definitely not the
Of
right salmon to eat. Then
course.
again, the type of food you are going to take, or the origin of the food you are going to eat, is going to be to make a huge difference on your inflammation side.
Yeah.
And processed food is definitely not the
Yeah.
right things to take. And as you say, they have a way to hide so many things in the
Oh
processed food,
yes. Yeah. Yeah.
then you think it's, and the marketing is so good, oh, eat
Oh, it's
this,
great.
it's
Yeah.
like,
The
yeah,
lies,
right, 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 right.
the lies never stop, Sylvain.
Yeah, yeah. Then
Couple lies.
I think diet is huge, but stress, sleep, xenobiotics, everything you are exposed to, what you breathe. For example, I don't know how many times I saw patient and say, do you wear a mask when you clean your house? And say, no. Say, do you realize then the product you use to clean your house, you breathe in, and is going to increase the inflammation? And it's, 100% of the time, people say, nobody told me that. So,
Right.
but do you think then if he's able to dissolve any bacteria on your countertop, you don't think it's going to not do nothing inside? That, yeah, right, right.
You.
Then all these small things, there is 8 parameters about chronic inflammation, and we often focus on the diet because it's, it's the visible part. It's easy to see, okay, what do I need to eat? Do I need to eat processed food, or do I need to eat a fruit? And all fruits are not equal too. A banana, there is way more sugar than, adapt your diet to reduce the amount of sugar you are going take, all that is we look at the diet, but your stress is big, your sleep is big, um, chronic infection, if you are often sick or exposed. I don't know how many times I talk to my patients, say, when did you clean your air conditioning system the last time? So
Oh,
I
yeah.
don't know, 5 years ago when I buy the house. So, okay, do you realize that the mold in the system,
I've been in there.
it's full of dust and
Yeah.
bacteria and all that? No. So, okay, when did you clean your fridge the last time? A big cleaning, remove
Yeah.
everything.
Yeah. You don't see that
Uh,
regularly, don't you?
yeah, right. And it's
Keep up
just
quick.
small thing. No, but they don't, it's not visible. Then diet is important, but I think as I say, xenobiotic chronic infection, sleep, stress,
It's,
diet,
yeah.
gut health, exercise, and inactivity. Again, in the exercise side, we have a bunch of clients coming to see us and say, okay, I
Mhm.
don't know what I'm doing, but I go to the gym every day. I work out, I eat well, but I don't lose weight. And when you
No, you
look at the
won't.
things,
You
you
won't.
say, okay, you don't exercise in the right zone,
No.
zone two, zone three, and because of that, you don't use the right fuel, then you use your sugar.
Yeah.
Then when you are done with your glucose, you are going to begin to degrade your muscle,
Yeah.
and your muscle is your best friend
You're not
to
doing it
eat
though.
your fat. Then you need to change your way you work out. And I think zone two training when you have a concussion is really important because when you do and zone two training is 60 to 70% of your maximum heart rate, and it's 220 minus your age and 60 or 70%. But what we saw in when we do metabolic testing, 99% of the people we test are not in the theoretical zone
Oh,
two.
all right.
They are lower often, and or they have a really small zone two. Then it's a really challenge. But I think the type of fuel you use on your everyday life is going to change too. What you eat, but how you
Yeah.
use your fat when you exercise will make a difference. Then yes, diet, but I think there is so many things. And again, small tweak. If you don't feel if you have a concussion, go for a 30-minute walk outside.
Hmm.
Then one you are depending where you live, but normally you will have fresh air, and at the same time you will use the right fuel because this fat is the best fuel you can give to your brain
Yeah, of course.
to help him recover his energy level and feeling better. You know,
Mm.
some study was talking about fasting, but there is not a clear yes or no about fasting and concussion. And I don't think I will not say anything about that. But I think 2 minute twitch on few things can make a huge difference. Not only the diet, but as I said, sleep is really important. It's the first things I'm
Yeah, of
asking to
course
my
it is. Yeah.
patient when they come for a concussion. I say, okay, which type, how is your sleep? And if the sleep is bad, okay, you need to fix your sleep first because your brain can't recover if you don't sleep well. Then
Well,
it's all
yeah.
together.
No, it's interesting you mentioned fasting because fasting has been one of my disciplines and I've learned over the last 20 odd years. And this is something that I have a deep passion for helping people to fast. Now, in terms of fasting and anti-inflammatory and immune boosting, fasting, when done correctly, has to be something that you work up to. You can't just start doing it I always equivocate it, Sylvain, to like trying to run a marathon. You can't just get up one day and go, I'm going to run a marathon today. You have to, if you're
Oh,
not
you
a,
can, you can. You
no,
will
you
not finish,
can't.
but you can.
Well, what happened to the first guy that ran the marathon? and he was 27 miles to warn the Greeks of he ended up dropping dead. So that's the kind of like irony of it. But fasting has to be worked up to very carefully. So if you've never run in your life, you can't run a marathon straight away. You have to learn to how to run maybe a few hundred meters, and then maybe work your way up to half a mile, and then a mile, and a couple of miles, 5 miles, 10 miles, and so on. So the key science of fasting is to be able to adapt your body and your mind and your spirit to be able to do that. Now, in my experience, fasting has always been one of the most anti-inflammatory ways of reducing inflammation, reducing cortisol, reducing all types of things that you'd associate with key stages of brain injury, post-brain injury and stuff as well. But there's not really many people out there to teach you that. I found it invaluable. It saved my life. And I still do water fasts now for 3 days. You get into ketosis, out
Yeah,
glucosis.
yeah.
In the past, 7, 14, even 21 days, a full parasite cleanse of the body to rid the body of parasite inflammation and things as well. But it's not for everybody. And anyone that's watched our podcast before knows that I don't recommend anybody to just start fasting. You have to have a good coach or somebody on your side. So,
I think fasting is really good. I was just thinking then if you had a concussion, do a fasting just after. I don't think it's a good idea because
no,
your
probably
brain
not.
needs to energy and all that. I think a better diet.
No, I agree with
But
it.
I I agree that fasting has a lot of advantage. And as you said, you need to do that in the right condition
Yes.
with the right guidance because you are not going to just stop eating for 3 days because you decide and it's done, you don't eat
No,
anymore, you know what
no,
I mean?
no, no, no,
And
because
and you can have really good because autophagy is beginning at 18 hours, then
I, unless you have
have
bulletproof coffee, if you have bulletproof coffee, you can get it going earlier.
oh yeah, I didn't know
Yeah,
that.
yeah.
And
MCT oil.
I think doing a 36 hours fasting can already be really good for people.
Yeah.
Going to 72 hours, I think, is asking a little bit more of help or yeah, more guidance. Me, I do fasting once in a while, and I after 24 hours, my brain is crazy clear, and
Yeah, yeah, yeah.
I often have my best productive day on the admin task that I ate when I fast because my brain is just clear and focused. And why? Because your liver is beginning to give the right fuel to your body. It's why I was
Absolutely.
saying zone two
Absolutely.
training is the good way to give the good fuel for your body. That's definitely a really important thing. But I like fasting. You know, I often do intermittent fasting on a daily basis. But you will not remove my coffee in the morning if you want me to smile, you know, definitely.
Yeah. Well,
But
that's it. Look, if you look into bulletproof coffee, so you got your coffee, your nice ground beans and stuff, and then you got a tablespoon of MCT oil and about half a tablespoon of butter ghee, and then you mix it up, and it's one of nature's best highs. And if you want to be have a really good coffee, bulletproof coffee is the way to go. So yeah, we should maybe park the fasting thing for now because it is a much deeper subject, and we don't have time to go
yeah, we can
really
spend hours
further
on
into
that.
that. Yeah, yeah, we could do, yeah, but it is a discipline that you have to work at, and it's not easy, and it's not for everybody, obviously. Um,
No, no.
um, Given that you've talked a lot about anti-inflammatory means and stuff as well, Sylvan, can you say a little bit more about stress hormones like cortisol, adrenaline, noradrenaline that you know about?
Um, I know stress level increase the level of cortisol, and the level of cortisol is going to increase in the inflammation in the body for sure.
Mm.
I didn't go too far on the adrenaline and noradrenaline. But stress is connected with chronic inflammation, definitely.
Yeah.
And as I was saying, high level of stress is going to change your gut health and the production of pro-inflammatory bacteria.
Mm.
Then I think stress is acting on many, the stress is to change a lot of things in your body. We can speak
Yeah.
about cortisol, we can speak about your sleep, we can speak about your gut health, you can speak about your inactivity because when you are stressed, often you are not going to work out or things like that. Stress again, sometimes you can have compulsive eating because
Mhm.
you are feeling
Yeah.
stressed. Then
Mhm.
you go there. A really good tools for stress is breathing exercise. We push with our patient. Yeah, we use isocapnic. It's a device, and we do breathing guided breathing exercise for our patient because breathing is going to reduce your level of stress, your level of cortisol, than a simple tool. And you don't need to do the Wim Hof method and jump in the ice. You know what I mean?
Yeah, no, I
You
like
don't
that,
need
to be
to.
fair.
Yeah,
I
yeah,
enjoy
I like that too. But
that.
I think just learn how to because the interesting things when we do the metabolic testing, we can see the breathing coordination of the patient.
Mhm.
And I will say 70% of the people doesn't breathe correctly.
Yeah.
Then shallow breathing or just not using all their lung capacity or all that.
Mm. Yeah.
And again, when the breathing for me is a good stress relief system.
Mhm.
Um, but again, you don't need to be a specialist just to learn how
No,
to breathe on a regular basis,
no.
diaphragm breathing and all that. And nose breathing, it's really important too. Then um, for stress, the biggest things we use is breathing for sure. If it's more psychological stress, we will send that to a specialist, a therapist or all that.
Yeah.
But
Oh,
on a regular basis, how to breathe correctly, I think can make a huge difference for people to reduce
yeah.
their stress level.
Well, yeah. I mean, recently seen information about how like the Vikings used to use breath work. They used it in a daily thing when they were like training what they were doing. They were using breath work, and like Wim Hof is obviously very good for breathing deep into your belly. So like and obviously the cold showers and ice baths. Yeah, I've got used to those now. Those are really nice because they just
Yeah,
make you feel fantastic. It's just like fasting and anything else is that sometimes the best solutions have the biggest
are
barriers
simple.
against them, don't they?
Mm.
Against people
But
doing.
ice bath doesn't have the same efficiency between men and women.
No, of course
Women
not.
are not made for this type of therapy
No,
and
no.
can have inverse effect, but men maybe I don't know because I'm off. I don't know why, but
Well, because of
men are
testosterone, probably.
yeah maybe
Yeah, because of
I don't know
testosterone.
why,
Yeah.
but studies show that cold plunge are better for men than for women. But cold
Absolutely.
plunge again is really good to our cortisol level and I think it's a mindset side. You
Yeah.
push yourself in, and I do cold plunge once in a while. I don't have a cold plunge at home, but I go at the Nordic Spa thing like that, and it's more a brain training. I'm
Yeah.
able to push me to do something I really don't want to do.
Mm.
Than like a cold shower in the morning. This type of thing, then it's like training your brain to do something you really don't want to do. And I think it's
Absolutely. Yeah.
good on the physiological side, but I think on the mindset side is really powerful too.
Yeah, no, that's a good point. And, always, since I learned that method and I thought, well, I'll try it and I go to like 2, 3 minutes and the cold shower in the morning, even in winter, is like, well, actually afterwards, it'd be so revived and my inflammation levels would go right down. And it's about learning to understand the differentials between, uh, well, with that, between cold and hot. With fasting, it's between hunger and the lack of hunger that fasting brings about. Because when I always fasted, you go the first 3 days are what you get, what called keto flu, ketogenic flu. So your body's shedding, your mind is shedding, your spirit, your heart is shedding. So you'd have like mild headaches, you'd have like maybe a closed throat. You'd have other stuff as well. After that third day, it'd all clear up and everything go really quiet and lovely. And your whole body, your mind, your spirit just seems really alive and much elevated. Um, so yeah, there are certain hacks and things like we talked about, life hacks and biohacks. You talked about it. You brought it up before the podcast. So, are there any other biohacks or things that you care to share with us before we sign off, Sylvain?
Um, Red light for
Yeah.
me, but red light with the right wavelength, 610 to 620 or 850
Mhm.
um, for a mitochondria activation. And it's helping on stress and sleep.
Yeah.
Then I think we are really strong on red light at the clinic because it's an easy biohacking.
Mhm.
We
Okay.
we are looking to begin to do some IV drip, but again, the science behind is not always there. Then I'm on the edge to decide if we are going to implement.
Okay.
But have a red light at home. It's an easy way. Um, and you can buy red light panel, for not too
Yeah.
expensive. Then you can do from home.
Mhm.
Us at the clinic, we have medical grade red light with full body panel. Then people just lie down and have a full body red light session. Then it's a little bit different. But if you can't have access to a red light room or a clinic doing red light, I think have a red light at home. It's an easy one.
Mhm.
Um, I think be aware of your environment. Cleaning your duct and cleaning your air conditioning system, your ventilation,
Yeah.
clean your fridge to remove some old stuff that it's
Yes.
way far in the corner of the fridge
Yes.
than
I did
uh,
remember.
yeah, right, right. Um, some food are not made to stay in the fridge, like rice. Don't
No.
keep your rice for days, because it's going to grow some bacteria and you
Yeah.
can contaminate all your fridge. Then
Yeah.
it's small. Again, I'm not a big believer in changing everything. Like 90% of the people go in January and say, my new resolution is that. And after 1 month, all gone. It's just small tweak. Then if I'm lucky because I have access to a bunch of technology at the clinic, then when the patient are gone, I'm jumping in the red light almost every day. We do vibration plate too. It's really good for lymphatic drainage if
Hmm.
you don't have access to a therapist to do lymphatic drainage.
Yeah.
But if I will do a small budget biohacking stuff in my house, I will go with red light, vibration plate,
Yeah.
and um, breathing. That will be
Mhm.
the three
Yeah.
things I will implement.
Yeah, that's
For sure, be careful about what I eat, definitely. But the three main, yeah, it's easy to implement, and you can do that from home if you don't have the time.
good.
But my biggest things is I do that because I did my metabolic test. Then I know exactly how my body is working and I'm able to
Yeah.
understand what's
Sure.
the small tweak I need to do. But I think the first things for any people who wants to improve their life is going to do a metabolic test at least and a blood test to see where they are.
Yeah.
But
That's good. That's good advice. Yeah. I'd agree with that.
yeah, and a lot of clinics, I think in UK, there is more and more people doing metabolic tests,
Yeah, there are. Yeah.
and
True. Very true.
I think that's the starting point of your health journey. The challenge when you have a concussion is you can't do a metabolic test because you are going to increase your heart rate, and because your heart rate is increasing, you are going to feeling like really not good, because you are going to increase the symptoms of the concussion.
Yeah.
But my opinion, as I said, if you are not under a post-concussion stuff and you begin to be able to do some exercise and all that, do your metabolic test. At least it's the base. And from the metabolic test, you can understand how your body is working and
Mm.
do the small tweak. And often, because you do metabolic test in a clinical environment, your clinician will be able to guide you and say, okay, now that's the data we have. Your breathing coordination is bad. Your mitochondrial health is
Yeah.
not good. Me,
Yeah.
my zone two was not really good, and I needed to work on it. My breathing coordination was not the best one, and I was using too much sugar when I was breathing at rest. Then
Yeah.
the way I learned how to change my breathing at rest to be able to use more fat when I just sit down. Then all these small things on the long run can make a difference because, again, it's a marathon, it's not a sprint.
Absolutely.
It's years of implementing things, and um, stacking habit, I think, is a really important thing. Then what you already do, just add something. For example, me, my breathing exercise, I do that when I check my mail in the morning. My email
Oh yeah.
box,
Yeah.
I
Well,
do my breathing exercise at the same time. Yeah,
of course, the
and I
electricity
know
bill turns
then, yeah, right, right. It's the best way. Then I don't need to think. Fuck, I just said that. Oh my gosh. It's really good to work on my stress level. But I think stacking habit do 2 minute shift as the right, but you don't need to buy a crazy red light bed at 80K. You know what I mean?
No.
Does it make sense for people? But small things on the long run, it's not the 30-minute walk you are going to do one time a month who is going to make a difference. It's the 30-minute walks then you do every day who is going to make a difference on the long run.
Yeah. Yeah. Sure.
And I think for people for taking care of their health, it's just a small tweak they can do on a daily basis. Yeah, right, right. Yeah.
Yeah. Yeah, that was fascinating. Thank you so much for all of everything you shared with us today. It's been fantastic, and the more we do these podcasts, the more we get deep dives into different areas, and get so many comments and emails and things from people that have like, well, I'm further down the road and I'm trying to help other people, so they all always appreciate the type of wisdom that you brought to us today. So thank you so much for doing this. Is there anything, I mean, if you want to share any personal links or social media links, then, please send them to me and I'll include them in the uh, podcast videocast notes.
Yeah, yeah, but it's
Wow.
still the same. I think in 2020 was Mancuso osteopathy. Now it's Mancuso Clinic because we are not only osteopath. But I
Yeah.
will send you that. Thanks, David, to invite me. It was
Awesome.
really good to
Yeah,
touch
no,
base with
yeah,
you
yeah.
after 5 years and
5 years, yeah.
so many things happen. Yeah, right, right.
I know, where did it
And
go? Yeah.
yeah, right. And yeah, and if any people wants to reach out to us to try to um, to help them. I know we are in Canada, but it's a network, and we have a bunch of contact all around the world now with my position as the Canadian president of the CFO. Then I think we can definitely help people to find some specific place, maybe in UK, and they can send the info. I will be happy to check the place and say, okay, I think that's the right place, or or maybe not. I don't know, but again, I think every clinician try to do their best.
Mhm.
But I will send you my personal email, sylvain@mancusoclinic.com, and people can reach out to me if they need.
Awesome. That'd be great. And yeah, I'll include those in the podcast notes underneath the descriptions. So yeah, if you are watching Canada, I hope you are, then yeah, look, you can find Sylvain on Facebook and other places as well. So it only remains for me to say, well, obviously, what I didn't say at the start of this podcast was a very happy New Year.
Yeah,
Well,
you
it
too.
is a happy new year. It'll soon be the year of the horse on February 17th, after the year of the snake that we've just been through, which was a bit slippery, to be fair. So hopefully, you'll all have a much better year this year. And in terms of finding us on Spotify and YouTube and all the other podcast platforms, all you need to do is look for the Post Concussion Syndrome Awareness Podcast, and it'll come up fairly easily because it's been there for years now. So, thank you very much for listening and watching. And from Sylvan and myself, we'll probably just stay on for a little bit of a chat afterwards. Um, Good afternoon, good morning, good night, and happy New Year again. So.
Bye.
All good. Bye bye.